Chief Executive CY Leung said in his policy address, the community needs to be well prepared for retirement protection. To strengthen support for the elderly, the government will enhance the Old Age Living Allowance through two measures. First, adding a higher tier of assistance by providing a monthly allowance of $3,435 per person for elderly singletons with assets not exceeding $144,000 or elderly couples with assets no higher than $218,000. Second, relaxing the asset limits for the existing allowance from $225,000 to $329,000 for elderly singletons and from $341,000 to $499,000 for elderly couples. Mr. Leung said 500,000 seniors will benefit from the two measures in the first year, and the coverage of the Old Age Living Allowance will increase to 47%. To align with the direction of population policy to extend retirement age, the eligible age for elderly comprehensive Social Security assistance will be raised from 60 to 65. Those who are receiving assistance before the new policy takes effect will not be affected. To alleviate the burden of medical expenses on seniors and their families, the government proposes to lower the eligibility age for elderly health care vouchers from 70 to 65. About 400,000 more elderly people will receive $2,000 a year to purchase private primary care services. The fee waiver for public hospital and clinic services will extend to those aged 75 or above who are eligible to receive the higher tier of Old Age Living Allowance, benefiting 140,000 people. In addition, the government will study the feasibility of a public annuity scheme, consider issuing larger volumes of silver bonds, and setting a longer term. The administration will also encourage the financial sector to develop more retirement-related investment products.